Hello again, this is Jared Pitts, and today I'm going to be reading another article by Dr. Ray Peat. This one, as always, can be found on his website, raypeat.com, under the articles section. Before I get into the article, just want to remind you that you can support the channel by booking a 15-minute free consultation with me, and you can do that on my website, MissouriHealthCoach.com. You can also support the channel by using my links in the description of all my videos to purchase items that you're probably already purchasing. For example, aspirin, vitamin K2, D3, Cascara Sagrada, and other things that Dr. Peat researched and shared with us about. You'll get a little bit of a discount, and I'll receive a small cut from your purchase. Okay, this article is called Diabetes, Scleroderma, Oils, and Hormones. This is how it goes. The basic argument: stress and aging make cells less responsive in many ways by damaging their ability to produce energy and to adapt. The polyunsaturated fats are universally toxic to the energy-producing system and act as a misleading signal, channeling cellular adaptation down certain self-defeating pathways. Diabetes is just one of the quote-unquote terminal diseases that can be caused by the polyunsaturated vegetable oils, otherly known as PUFAs. Coconut oil in diabetes, as in other degenerative diseases, is highly protective. And just to give you a little bit of an idea of the difference in the fatty acid profile between coconut oil and your standard darling fat of the FDA, canola oil, you can see here saturated fat, 7% in canola oil versus 82 to 92% in coconut oil. Massive difference. Then you have monounsaturated fat, 63 in canola and 6% in coconut. And then here's the big thing though, polyunsaturated fat, 28% in canola and only 2% in coconut oil. So you can see why it would have those protective features. Moving on, when the oral contraceptive pill was new, and the name of that first contraceptive pill is here, Inovid, I think is how it's pronounced, and that's the first FDA-approved birth control or contraceptive pill that was sold, it was found to produce signs of diabetes, including decreased glucose tolerance. Spelacey and Carlson, 1966, suggested that an elevation of circulating free fatty acids might be responsible, and remarked that, quote, free fatty acids can block the Krebs cycle, with relative insulin action resistance resulting. The potential danger of the oral contraceptives is one of prolonged pancreatic stimulation. End quote. Recent papers are reporting that the estrogen used to quote-unquote treat menopause causes an increase in free fatty acids. Spelacey and Carlson suggested that estrogen's effect was mediated by growth hormone. And if you haven't read his article on growth hormone specifically, I've recorded that one, so you can find that one in my videos on my channel. And that is now the consensus. Women are much more likely than men to develop diabetes. Ephraim Racker observed that free unsaturated fatty acids inhibit mitochondrial respiration, and recent studies are finding that free linoleic and linolenic acids, and that's just your omega-3 and omega-6, act as intracellular regulators, stimulating the protein kinase C or PKC system, which is also stimulated by estrogen, and the C word promoting forbyl esters. They stimulate the cell while blocking the energy it needs to respond. And you'll find that a lot of these cell stimulators, that's the key word there, do the same thing. So Dr. Peat talks about aspartic acid, glutamic acid being similar in their action, where they quote unquote stimulate cells, right? And again, while blocking the energy it needs to respond. Scleroderma, or systemic sclerosis, is a supposedly mysterious condition in which tissues harden with an excessive deposition of fibrous material. Besides hardening the skin, it can involve fibrosis of the heart and other organs, and can cause changes in blood vessels of the kidneys, like those seen in some types of hypertension, and often involves Raynaud's phenomenon and osteoporosis of the fingers. Silicone functions as an adjuvant, and if you're not familiar with that, that's in, there's another word, the V word. You'll have adjuvants, and essentially what that means is it's an immune system stimulant. And so in a particular item, biologic, that is used on children, like the Hep B and things of this nature. Anyway, different ones will have different adjuvants, sometimes an aluminum compound, and essentially it's there to get a large response from the immune system. So, silicone functions as an adjuvant, making exposure to irritants, solvents, or infections more harmful, right? Because if you were exposed to something and you were going to have a immune response, well, if you have something that's going to really drum up that response, then it's going to become more harmful, right? A higher inflammatory response, etc. This seems to be the reason for the association between breast implants and scleroderma. Another type of disease that involves hardening of the skin is scleroderma, in which the skin thickens with an accumulation of mucin, quote-unquote mucin, between collagen bundles, and which fibroblasts are overactive in producing collagen. And that's from Varga et al. This condition is believed to often follow a febrile illness, and that's in quotes, right? Something involving a fever, and is associated with diabetes. My interest in these conditions comes from my awareness that estrogen promotes collagen formation, and that changes in the connective tissue are deeply associated with the processes of stress and aging, following the ideas of Mechnikov and Selye. And when the first sentence up there discussing stress, we know that he's going to bring up Selye, and so he has referenced Selye's research in a lot of his articles. So, but you can look up Selye's work and read it for yourself. Many people are still committed to the various old theories of diabetes, though a few are showing ways in which multiple causes can lead to diabetes. Increasingly, old age itself is seen to be, quote, like diabetes, end quote. And there's a couple of studies there. And the situation is ripe for a recentering of our understanding of diabetes around some of the general facts about aging and stress. Diabetes mellitus, as named, refers to excessive urination and sugary urine, but it is now often diagnosed in people who neither urinate excessively nor pass glucose in the urine, on the basis of a high level of glucose in the blood. Many other signs: abnormal mucopolysaccharide metabolism with thickening of basement membranes, leakage of albumin through capillary walls and into the urine, a high level of free fatty acids in the blood, insensitivity of tissues to insulin, or reduced sensitivity of the beta cells to glucose. And these beta cells that it's referring to are the ones that actually create the insulin, as a response to glucose, right? So if you have reduced sensitivity of those beta cells, then you're not producing the amount of insulin that you probably need for the amount of glucose that you have. Okay, so to read that sentence again. Many other signs are considered diagnostic by some people. And we had a list of signs there. Who believe that the worst aspects of the disease can be prevented if they can diagnose early and take preventative measures. This attitude derives largely from the genetic theory of causation, though it incorporates a belief that environmental intervention can ameliorate the course of the disease. Okay, and we see this everywhere, right? This early diagnosis crap. I have a friend whose wife had a baby a couple of months ago, and they're already doing a pap smear, and this is probably, standard of care. But I'm so far removed from standard of care these days because of my lack of trust of the system. But, they do this pap smear. They say, oh, we found some, again, a couple months after giving birth to a baby, vaginal birth, and, oh, we found some abnormal cells. So now we need you to come in for this other procedure that is more involved and more stressful, and where they scrape even more tissue off of your cervix. And of course, which is going to cause more damage to the cervix, and they do this all in the same location every time, and you end up, causing issues with your cervix, and they continue to see, worse and worse cells through this process, of course, because they are the ones injuring the tissue. And, before you know it, they're saying you have cervical cancer or whatever. Okay, all in the name of early intervention, early diagnosis, and preventative measures, right? Anyway, there's a pattern, let's just say. And I don't trust the pattern. I don't trust that model. I won't say whether you should or not. That's up to you to decide. Okay, but it's talking about, with diabetes specifically, this early diagnosis and treatment, intervention. Okay, from my experience, intervention begets intervention, further intervention, let's just say, and a future customer, if you will. Moving on. When I wrote Nutrition for Women, I mentioned that the sudden appearance of diabetes in non-European Jews when they moved to Israel made the genetic theory of diabetes untenable. And since then, other studies have made the similar point that environmental factors seem crucial. And that's from a study by Shaltout et al. Many people are arguing for the racial/genetic theory of diabetes, but they are failing to consider some simple dietary factors, especially the high consumption of unsaturated seed oils and the combination of nutritional deficiencies and environmental stress. I have known adults and children who were diagnosed as diabetic and given insulin and indoctrinated with the idea that they had a terminal degenerative disease on the strength of a single test showing excessive glucose. When I taught at the Naturopathic Medical School in Portland, I tried to make it clear that quote-unquote diabetes, a term referring to excessive urination, is a function, and that a high level of glucose in the blood or urine is also a function, and that the use of insulin should require a greater diagnostic justification than the use of aspirin, for a headache does, because insulin use itself constitutes a serious health problem. And we seldom hear the idea that quote-unquote diabetes might have a positive side. That's from Robinson and Johnston. For example, that it reduces the symptoms of asthma. There's from Viana and Garsalini, which get worse when insulin is given. Normal pregnancy can be considered quote-unquote diabetic by some definitions based on blood sugar. I got interested in this when I talked to a healthy, quote-unquote diabetic woman who had a 2-year-old child whose IQ must have been over 200, judging by his spontaneous, precocious hobbies. old gynecologists told me that it was common knowledge that quote-unquote diabetic women had intellectually precocious children. When non-diabetic apes were given insulin treatments, they developed some of the same quote-unquote complications of diabetes that are seen in humans, and antibodies to insulin were found in their retinas, suggesting that some quote-unquote complications of diabetes were complications of insulin treatment. Patients were seldom well informed of the arguments against the use of insulin, but the justification for the new, genetically engineered human insulin is precisely that it avoids immunological damage. Insulin was introduced into medicine in the 1920s. According to the Britannica Book of the Year for 1947, page 265, quote, mortality from diabetes in 1920 in the United States was 16.0 per 100,000, or 14,062 deaths. But in 1944, so this is 24 years later, it was 26.4 per 100,000, or 34,948 deaths. End quote. So quite the huge increase there. One of the theories of the cause of diabetes is that a virus damages the beta cells in the pancreas. And the main argument for that in the 1970s was that the onset of diabetes in children can often be dated to a time shortly after a severe viral infection. It is true that intense sickness and a high fever and high doses of drugs given to treat the sickness can cause very high levels of glucose in the blood, and even glucose in the urine, but this is a fairly well recognized consequence of stress. High doses of cortisone, prednisone, etc., typically cause elevated glucose levels. Cushing syndrome usually involves hyperglycemia. And even the mainstream recognizes Cushing syndrome as excess cortisol, right? Normally, this is just a functional response to an excess of glucocorticoids. But studies in dogs suggested that intense and/or prolonged stress can damage the insulin-secreting cells in the pancreas. Dogs had half of their pancreas removed to increase the burden put on the remaining tissue, and after a large dose of cortisone, the dogs became and remained diabetic. One of the problems associated with diabetes is the calcification of blood vessels, though now there is more emphasis on fatty degeneration. Other blood vessel problems include hypertension and poor circulation in general, leading to gangrene of the feet, impotence, and degeneration of the retina. In muscles, and probably in other tissues of diabetics, capillaries are more widely spaced, as if the basal oxidative requirement were lower than normal, right? And that makes sense, that if essentially you're creating less energy, you have less cellular respiration, then you need less oxygen delivered to the cells, and thus less capillaries. Okay, moving on. However, mitochondria contain more respiratory enzymes, as if to partly compensate for the poor delivery of oxygen to the cells. Osteoporosis or osteopenia is a common complication of diabetes and seems to be associated with the calcification of soft tissues. And this is just kind of a part of every disease where you have things like calcium or other necessary nutrients being removed from where they should be and placed where they should not be. F.Z. Mearson's description of the stress-injured heart is very similar to the general changes that occur in chronic diabetes. He found that the stressed heart becomes rigid and unable to contract completely, or to relax completely. And I talk about this here and there, but Dr. Peat talks about the Achilles tendon reflex test and how it can show you kind of whether you're hypo or hyperthyroid. Typically, it seems that people are hypo, and so you can look up the Achilles tendon reflex to kind of see how well you respond, how well you can contract, and then how well or quickly you can relax. And it's kind of a cool test. A lot of people will put their knee on a couch and have their leg pointed back, and you can have someone hit your Achilles tendon gently, but like with a reflex hammer, or I've used a butter knife, not the end that you spread with, but with the other heavier end that you would hold, and you can watch your foot contract just like you would see your leg kick when the doctor, hit your knee reflex with a reflex hammer. And then you can also see it, so you'll see it reflex, you can see it contract and then relax. And you actually have to be able to create energy in order to relax, which is kind of counterintuitive, or you might not think that that's the case, but that is the case. And so people that are extremely hypothyroid, their foot will relax extremely slowly, or even just slightly slowly, depending on how hypothyroid they are. Okay, but he's talking about the heart muscle in this situation not being able to contract completely or to relax completely. Excess calcium enters cells, and fatty acids are mobilized both locally and systemically, and both of these tend to damage the mitochondria. In diabetes, fatty acids are mobilized and oxidized instead of glucose. And calcium enters cells, increasing their rigidity and preventing relaxation of muscles in blood vessels. I'm not sure whether it is relevant to cell physiology, but the presence of an excess of free unsaturated fatty acids and of calcium in cells makes me think of the insoluble soap that these substances form in other situations, including the intestine. It seems that this could form a harmful deposit in cells, blocking many metabolic processes. Okay, and he's talking about calcium entering cells. And I think this was in the last article that I read, but when you're in a good state, a good metabolic state, you have magnesium and potassium entering cells, whereas you have higher concentrations of calcium and sodium outside of cells. And again, just like the calcium in the bones versus calcium in the soft tissue, right? You have the wrong stuff or the right stuff in the wrong place, right? So that's what he's talking about. But if you look back at my most recent video, I talk about that more in depth. For many years, histologists have observed that calcium and iron tend to be deposited together in quote-unquote devitalized tissues. Now we know that cell death from a great variety of causes involve the cell's absorption of increased amounts of calcium. Simply the lack of energy increases the amount of calcium in a cell, and stimulation or excitation, and there's the word, does the same, right? Excitation, like with glutamic or aspartic acid, creating or exaggerating a deficiency of energy. In low thyroid people, many, if not all, tissues are very easily damaged. Since glucose is needed by liver cells to produce the active T3 form of thyroid, diabetes almost by definition will produce hypothyroidism, since in diabetes glucose can't be absorbed efficiently by cells. And this is why Dr. Peat talks about people using fructose when their cells can't efficiently absorb glucose, because fructose does not require insulin in order to transport it into the cells. Moving on. In the form of cell damage caused by the quote-unquote excitotoxins. And let me just say this. I was just talking about potassium moving into cells, right? And people will find when they have insulin issues that potassium can be helpful. Why is that? Partly because it's moving into the cells. That's where it should be. And so it has this insulin-like action to it. In the form of cell damage caused by the quote-unquote excitotoxins, glutamic and aspartic acids, there they are, the damage seems to require both stimulation and difficulty in maintaining adequate energy production. This combination leads to both calcium uptake and lipid peroxidation. When cells are de-energized, they tend to activate iron by chemical reduction, producing lipid peroxidation. This could explain the presence of chemically active iron, but an actual increase in the iron concentration suggests that there has been prolonged injury or oxidative stress to the cell, with increased production of the heme group, which binds iron. Hans Selye found that he could produce scleroderma, the hardening and calcification of the skin, in rats by giving them a toxic dose of a heavy metal, and then irritating the skin a little by plucking hair. Iron is now tending to be recognized as a factor in inflammation. Vitamin E was able to prevent the development of scleroderma under Selye's experimental conditions, suggesting that the irritation allowed the heavy metal to cause oxidative damage to the skin. Selye found other ways to cause calcification of tissues, including the walls of arteries, but he directed most of his attention to the role of quote-unquote pro-inflammatory hormones. A decreased blood supply was often used to predispose an organ to calcification. In diabetes, a characteristic feature is that the blood supply is relatively remote from cells in muscle and skin, so the oxygen and nutrients have to diffuse farther than in normal individuals. And the ATP level of cells is characteristically lower than normal. In blood cells, both red, Garnier et al., and white cells are probably more rigid in diabetes because of lower ATP production and higher intracellular calcium and sodium. Magnesium in the cell is largely associated with ATP as the complex Mg-ATP, right, or magnesium ATP. When ATP is quote-unquote used or converted to ADP, this lower energy substance associates with calcium as calcium ADP. In a hypothyroid state, the energy charge can be depleted by stress, causing cells to lose magnesium. ATP is less stable when it isn't complexed with magnesium, so the stress-induced loss of magnesium makes the cell more susceptible to stress, by acting as a chronic background stimulation, forcing the cell to replace the ATP, which is lost because of its instability. In this state, the cell takes up an excess of calcium. So, we're seeing a pattern here. We do not want these cells to be taking up an excess of calcium. The picture that I think explains many of the features of diabetes is that an energy deficit produces an alarm state, causing increased production of adrenaline and cortisol. Adrenaline mobilizes fat from storage, and the free fatty acids create a chronic problem involving 1. Blocked ATP production, 2. Activation of the protein kinase C system, increasing tension in blood vessels, 3. Inhibition of thyroid function with its energetic, hormonal, and tissue structure consequences, 4. Availability of fats for prostaglandin synthesis, and 5. Possibly a direct effect on clot dissolving. Besides the PAI-1, or plasminogen activator inhibitor, effect seen in diabetes, and there are several studies, estrogen has many pro-clotting effects, and one of them is a decreased activity of vascular plasminogen activator. And that's from a study called Venous and Arterial Thromboembolic Disease in Women Using Oral Contraceptives. And so these people reported that estrogen promotes thromboembolism by increasing clotting factor 9 in the blood. Increased entry of calcium into cells is complexly related to increased exposure to unsaturated fatty acids, decreased energy, and lipid peroxidation. Osteoporosis, calcification of soft tissues, and high blood pressure are promoted by multiple stresses, hypothyroidism, and magnesium deficiency. The particular direction a disease takes, diabetes, scleroderma, lupus, Alzheimer's, stroke, etc., probably results from the balance between resources and demands within a particular organ or system. Calcium overload of cells can't be avoided by avoiding dietary calcium, because the bones provide a reservoir from which calcium is easily drawn during stress. In fact, the reason calcium can temporarily help prevent muscle cramps seems to be that it makes magnesium more available to the muscles. If we want to stop a disease that involves abnormal calcification or contraction of muscle, see Zinnier et al., we can increase our consumption of magnesium, and to cause cells to absorb and retain the magnesium, we can increase our thyroid function. The use of coconut oil provides energy to stabilize blood sugar while protecting mitochondria and the thyroid system from the harmful effects of unsaturated fats. In 1947, B. A. Hussey found that a diet based on sugar as a source of energy was more protective against diabetes than a diet based on lard, while the most protective diet was based on coconut oil. Lard reflects the pig's diet and is usually extremely unsaturated, especially since it became standard to fatten them on soybeans and corn. And I have found this to be true. I'll eat pork that's really fatty, and I wake up with a PUFA hangover almost every time, just like I got hit by a train. Extremely foggy, and so anyway, I avoid eating pork a lot of the time because of how much it affects me, and obviously because of the PUFA. Essentially, his study seems to show that unsaturated pork fat permits diabetes to develop. Sugar is highly protective, and coconut oil is very protective against the form of diabetes caused by a poison. At the same time, A. Lazaro was demonstrating that a low-protein diet made animals more sensitive to diabetes, and that cysteine, glutathione, and thioglycolic acid, or antioxidants, are protective against diabetes. The chelator of metals, BAL, or British anti-leucite, was also found to protect against diabetes. Taken together, those studies suggest that the oxidizable unsaturated fats are involved in the process of producing diabetes. At the same time, other studies were showing that the unsaturated oils suppress the thyroid, and the coconut oil increases the metabolic rate, apparently by normalizing thyroid function. Hypothyroidism is known to include deposition of mucopolysaccharides in tissues, increasing permeability of capillaries with leakage of albumin out of the blood, elevated adrenaline, which can lead to increased production of cortisol, decreased testosterone production, high risk of heart and circulatory disease, including a tendency to ulceration of the extremities, and osteoporosis, all of which are recognized quote-unquote complications of diabetes. Broda Barnes gave all of his diabetic patients a thyroid supplement and found that none of them developed the expected complications of diabetes. And I think Chris Masterjohn with Joe Rogan noted that in his most recent interview. I think it's his only interview that he's done with Joe Rogan. But anyway, that was just awesome to hear in such a mainstream interview. Broda Barnes' name. So, okay, and then I also wanted to note that this mucopolysaccharide that it keeps bringing up, this deposition of it in tissues, a lot of people, I know I've heard Dr. Peat mention some of the physiological signs that you'll notice of this mucopolysaccharide being placed in tissue are like bulging eyes, because a lot of the time it'll get placed behind the eye, and it ends up, pushing your eyeball out. So you have this bulging eye effect. And then also in the joints of the fingers, and so a lot of the time people with like crooked fingers, this is what's happening. The body's putting this mucopolysaccharide in those joints and kind of pushing part of your finger one way or the other way. So probably a good sign of some type of hypothyroidism. Recently, a high safflower oil diet was found to cause diabetes, and that's from Ikimoto et al. And obesity itself is thought to be a factor in developing diabetes. The hormone patterns associated with diabetes can be seen as either cause or effect of the obesity, or both cause and effect. Since, for example, low thyroid can increase both estrogen and cortisol, which support the formation of fat, and the fat cells can become a chronic source of estrogen synthesis. And this is that self-amplification process that I talk about maybe every video of how these things just amplify themselves. On a diet lacking the quote-unquote essential, and obviously a lot of the time when he's doing these quotes, right, he's using the term that mainstream would use, and it's almost in an ironic way most of the time. Okay. On a diet lacking the quote-unquote essential unsaturated fatty acids, Benhamo in 1995 found that non-obese diabetic mice didn't develop diabetes. That is, the unsaturated fats themselves, without obesity, are sufficient to cause diabetes. And then it also says, also see Gerard, Golay et al., and Kusumoki et al., so a couple more studies. Estrogen and the polyunsaturated fatty acids, or PUFAs, linoleic and linolenic acid, omega-6 and 3, alike activate the protein kinase C, or PKC system of cellular activation. Many of the functions of PUFA are similar to the functions of estrogen. For example, antagonism to thyroid function, promotion of age pigment, or lipofuscin. So this information showing that they both act similarly on the same basic regulatory pathway is important. Estrogen increases secretion of growth hormone, and in parentheses we have GH. It's closely associated with prolactin, also increased by estrogen. And growth hormone causes an increase in free fatty acids in the blood. Estrogen promotes iron retention, so it sets the stage for oxidative stress. At least in some systems, both estrogen and PUFA promote the entry of calcium into the cell. In diabetes, there is a generalized excess activation of the PKC system. The starch-based diet, emphasizing grains, beans, nuts, and vegetables, has been promoted with a variety of justifications. When people are urged to reduce their fat and sugar consumption, they are told to eat more starch. Starch stimulates the appetite, promotes fat synthesis by stimulating insulin secretion, and sometimes increases the growth of bacteria that produce toxins. It is often associated with allergens, and according to Gerard, Volkheimer, whole starch grains can be, quote-unquote, presorbed from the intestine directly into the bloodstream, where they may block arterioles, causing widely distributed nests of cell death. I have heard dietitians urge the use of quote-unquote complex carbohydrates, or starch, instead of sugar. In the first physiology lab I took, we fed rats a large blob of moist cornstarch with a stomach tube, and then after waiting a few minutes, were told to dissect the rat to find out how far the starch had gone. In such a short time, we were surprised to find that not a trace of the starch could be found. The professor's purpose was to impress us with the rapidity with which starch is digested and absorbed. Various studies have demonstrated that starch composed of pure glucose raises blood sugar more quickly than sucrose, which is half fructose and half glucose. The sudden increase of blood glucose is sometimes thought to contribute to the development of diabetes, but if it does, it is probably mediated by fat metabolism and the hormones other than just insulin. Brewer's yeast has been used successfully to treat diabetes. In the 1930s, my father had severe diabetes, but after a few weeks of living on brewer's yeast, he recovered and never had any further evidence of diabetes. Besides its high B vitamin and protein content, yeast is an unusual food that should be sparingly used because of its high phosphorus to calcium ratio, high potassium to sodium ratio, and high estrogen content. The insulin-producing beta cells of the pancreas have estrogen receptors, but I don't know of any new research investigating this aspect of yeast therapy. In rabbit studies, diabetes produced by alloxin poisoning, which kills the beta cells, was cured by DHEA treatment, and beta cells were found to have regenerated in the pancreatic islets. I think the basic anti-aging diet is also the best diet for prevention and treatment of diabetes, scleroderma, and the various quote-unquote connective tissue diseases. This would emphasize high protein, low unsaturated fats, low iron, and high antioxidant consumption, with a moderate or low starch consumption. In practice, this means that a major part of the diet should be milk, cheese, eggs, shellfish, fruits, and coconut oil, with vitamin E and salt as the safest supplements. It should be remembered that amino acids, especially in eggs, stimulate insulin secretion, and that this can cause hypoglycemia, which in turn causes cortisol secretion. Eating fruit or other carbohydrate, coconut oil, and salt at the same meal will decrease this effect of the protein. Magnesium, carbonate, and I'll just note here that I've heard Dr. Peat in other places encourage the eating of eggs specifically because of the quality of amino acid, the quality of protein in the egg. But again, he says, if you have trouble sleeping or anything, don't eat eggs after a certain time because, again, if they cause hypoglycemia for you, that's going to wake you up in the night and things like this if it lowers your blood sugar, right? But again, like he's saying, eating some type of good simple carb with it or coconut oil will decrease this effect. Magnesium carbonate and Epsom salts can also be useful and safe supplements, except when the synthetic material causes an allergic bowel reaction. Although I started this newsletter with the thought of discussing the mead acids, the unsaturated omega-9 fats that are formed under certain conditions, especially when the dietary polyunsaturated fatty acids are quote-unquote deficient, and their prostaglandin derivatives as a distinct anti-stress, anti-aging system, the loss of which makes us highly susceptible to injury. I will save that argument for a future time, leaving this newsletter as an addition to the view that an excess of the polyunsaturated fats is central to the development of degenerative diseases. The big C word: heart disease, arthritis, immunodeficiency, diabetes, hypertension, osteoporosis, connective tissue disease, and calcification. All right, once again, another fantastic article by Dr. Peat. Please like this video, subscribe to the channel, and share this with a friend of yours that is dealing with these issues. And hopefully, as you learn, you'll be able to explain some of these concepts to them and, help some people that you know. As usual, I'm not here to give recommendations, just to read Dr. Peat's work, provide some commentary on it, and I hope that this is helpful for you, your friends, and your loved ones. Until next time, God bless.